Hi everyone, we're going to be talking about squamous cell carcinoma, or SCC for short. Our group members are Caitlyn, Mickenzie, Sophia, and Katie. Let's get started by understanding what exactly SCC is. Squamous cell carcinoma is the second most common skin cancer in the United States. It actually accounts for most non-melanoma skin cancer-related metastatic cases and deaths. The number of people affected by SCC keeps rising every year, which makes it a growing public health concern. To give some perspective, in 2012, about 40 out of every 100,000 American men and 50 out of every 100,000 American women were diagnosed with SCC.
There are several risk factors that increase someone's chances of developing SCC. These include immunosuppression, meaning a weakened immune system, chronic wounds that don't heal properly, having fair skin, being of the male gender, older age, certain genetic syndromes, and UV radiation like from sun exposure or tanning beds. And finally, having a previous history of squamous cell carcinoma increases the risk of reoccurrence. If SCC isn't treated, it can lead to serious complications. These can include metastasis, meaning the cancer spreads to other parts of the body. It can also cause local invasion, where it grows into nearby tissues. Patients might experience pain, loss of function, or poor cosmetic outcomes depending on the area infected. And in severe cases, unfortunately, squamous cell carcinoma can result in death.
Clinically, SCC most often appears on the tongue or gingiva, but it can also occur in other areas of the oral cavity too. It typically presents as a red and white lesion with sharp margins and often forms a firm ulcer. In more advanced cases, lesions may appear speckled, showing both red and white areas. Recognizing these features early is key to better outcomes. When it comes to treatment and management, there are a few main options. The first is surgical excision, which removes the cancerous tissue. In some cases, a skin graft might be needed to repair the area after surgery. Radiotherapy can also be used to destroy cancer cells. And for more advanced or spreading cases, chemotherapy may be recommended. The exact approach depends on how early the cancer is caught and when and where it's located.
The good news is that SCC, if caught early and localized, the prognosis is generally excellent. Overall, the mortality rate for squamous cell carcinoma is about 1 to 2%, so early detection and treatment plays a huge role in keeping outcomes positive. To wrap things up, surgical resection remains the main therapy for treating SCC. Although the overall mortality rate is low, about 3% of cases can metastasize, meaning they spread to other parts of the body. This highlights how important early detection, prevention, and regular screenings are when it comes to squamous cell carcinoma.